Hello, this is a case of a shallow, wide uterine septum that connects the upper anterior part of the uterine wall to the posterior part of the uterine wall, involving probably the upper third of the uterine cavity. It was the only identifiable cause for the patient's recurrent miscarriages, and so we are performing resection of this septum in hope to improve the pregnancy outcome in the future. We're using glycine as a distension media and electrosurgery to cut the fibers of the septum. This is done till the septum is completely resected, and we can tell that it's completely resected because the color of the fibers changes from whitish to more like fleshy, muscular color, and also by noting that the level of the new upper part of the uterus, the fundus, is at the same level more or less with the openings of the fallopian tubes on the right and on the left. This is the opening on the right side. After surgery, we usually give the patient estrogen pills for a couple of months with the intent to help build new endometrium to cover the denuded area of the resection. These little flying things, tree-like things, are just normal endometrial tissue of the uterus. You can see the whitish fibers of the septum, and beyond it is the reddish, brownish muscular tissue of the uterine wall, which indicates that the septum has been more or less completely resected. What the septum does is that it makes the uterine cavity two smaller cavities, or a distorted cavity, and that's why miscarriages happen. And normalizing the appearance of the cavity improves the pregnancy outcome.